has spread to all but one of the 22 governorates, with more than 480,000 suspected cases and nearly 2,000 associated deaths from cholera and other diarrhea-related diseases. The number of new cases has been declining for several weeks, having plateaued in the four most affected governorates of Sana'a City, Hodeidah, Hajjah, and Amran. However, there are concerns the numbers could rise as Yemen heads into its rainy season, while health workers have not been paid in nearly a year, and some 8.8 million people are living in areas without enough health centers. The UN and its partners have set up more than 200 cholera treatment centers and more than 900 oral rehydration points. Regular UN-operated flights carrying supplies to address cholera between Djibouti and Sana'a began last week, and we have received less than half of the 254 million we need to respond to the cholera outbreak
in Yemen, and especially to the Sana'a airport. And then I read a report by a Norwegian refugee agency saying that 10,000 Yemenis are killed as a result of the denial of access to medicine abroad. The continued closure of Sana'a airport may cost more human lives than the war itself. What's the United Nations doing about that? You mentioned that there will be refueling soon, but we have heard this about more than 10 days ago.
What we've been told by our colleagues is that while there are regular commercial flights to Aden, the commercial flights to Sana'a have been restricted for now over a year. International NGOs have said that the closure of Sana'a airport effectively traps millions of Yemeni and prevents the free movement of commercial and humanitarian goods. And the humanitarian coordinator, Jamie McGoldrick, said that reopening of Sana'a would help alleviate the suffering of civilians. Aviation fuel for UN operations arrived in Sana'a from Aden yesterday, and the UN is maintaining flights from Djibouti and Amman to Sana'a and Aden. Obviously, any restrictions to ports, airports, all of that, hinder our ability to deliver humanitarian goods as we would want to see.
Staying on Yemen, reporters from Hajjah speak that there are no more places on pavements for people to die. Literally, almost half of the population is infected by cholera, and this is the nearest place to Saudi Arabia, which is leading this campaign against Yemen. Where the responsibility lies here? About Saudi Arabia and the coalition.
What we have said for many months now is that the humanitarian crisis in Yemen is a man-made crisis. That is clear. The conflict in Yemen burdens and forces the unspeakable suffering of the Yemeni people, who already were living in a very fragile society in terms of the humanitarian situation. That is why our colleague Ismail Sheikh Ahmed is continuing his efforts to bring about a political solution. In the meantime, our humanitarian colleagues and their Yemeni partners are doing what they can to deliver humanitarian goods, to deliver aid. I mean, you just heard what